I'm Mike Page with News and Now. We continue to bring you the very latest with this COVID-19 pandemic that we've been seeing worldwide. But right now, we're going to focus on Arizona because today, unfortunately, Arizona got a record that they just don't want to be a part of. They got a record of more than 12,000 cases in one day. So to get us a little bit better insight of everything that is going on in the state and really across the country, bringing in Dr. Shad right now, currently serving as the Director of Public Health Prevention and Health Promotion at the University of Arizona College of Medicine in Phoenix. So Dr. Shad, thank you so much for joining us here today.
My pleasure. Happy to be here.
So today with this record number, is this what we're seeing from Thanksgiving now as the holiday has passed?
Yeah, I think we're almost at about 2 weeks since that Thursday of Thanksgiving. And so we're definitely seeing the bump from the Thanksgiving holiday, given how many folks traveled out of state, how many folks probably from out of state came into Arizona, and all the different gatherings that took place during that time, in addition to just the fact that the viral numbers are increasing. They have been doubling every 2 weeks or so, which is why you've seen the steady rise in daily new cases over the last six weeks or so.
So for the rest of this week, in your opinion, what are we going to see some of these numbers just sitting at 10 to 12,000, or could it even go higher for a day?
Yeah, it could go higher for a day, and I think we're going to see numbers closer to 10,000, definitely above what we had been seeing before. Very unlikely for things to improve unless our actions and our behavior in terms of what we're doing on a day-to-day basis changes dramatically.
And for those changes, I mean, because right now, Arizona, in so many areas, you could still go to the restaurants, still go to grocery stores, still go to some of the big box stores. So are you saying more these things need to be limited severely, or this is going to continue to get out of control?
I think things are going to continue to get out of control unless we start doing mitigation measures. I think we need to use CARES money and other funds to shut down indoor dining, as well as bars and nightclubs, at least for 3 to 4 weeks. Pay the employees, pay the businesses, especially small businesses, so they can get through it. And then also expand our testing. And then also making sure that everybody has a mask on everywhere they are in public. I think some of these mitigation measures, we know that the masks plus shutting down the high risk indoor activities resulted in 75% decrease in cases back in July and August. So there's no reason to think that won't work again now. I'm not sure why we haven't done it yet.
And can you answer this question? I know a lot of people sometimes ask, they say, well, you can't go into a business without wearing a mask. We're wearing the mask, but why are the numbers still going crazy?
Well, I think it's also the gatherings. We now know that people are getting together at home and in other venues without masks, with people outside of their own household. There's also much more travel happening. Don't forget, we have the snowbirds, and we were, until very recently, promoting tourism with folks coming in from out of town, for those sports tournaments as well as for other activities. So we don't have any limitations in any of those areas. And you know how it works. It's like a slippery slope. As soon as the numbers start to get to a certain point, we've been doubling every 2 weeks. And so it's just more widespread in the community. So any activity you do is much higher risk now than it was, 2 months ago.
And doctor, we're coming up on, or we're such in a tough spot where so many people have had just a horrible and rough year. And we're coming up into Christmas when everybody thinks about those memories of being with family and friends. But what is your advice for people as they start talking about Christmas get-togethers or trying to visit family still?
Yeah, I know that there's a lot of pandemic fatigue. People are really tired of this. We're all tired of this. But hope is on the way with the vaccines, but we're going to need another 6 to 8 months until everybody who needs a vaccine gets a vaccine. And so until then, this Christmas, let's try to do virtual. If we have to see each other, let's stay outdoors with masks and distancing to protect ourselves and protect our loved ones so that we can be together for many Christmases and holidays to come.
Yes, and doctor, as you talk about the vaccines, can you kind of give us maybe a timeline of what to expect? So when this rolls out, it's first going to go to the frontline workers and those who really need it. But for every day person, I mean, we might not see this till the summer.
Yeah, for most folks, we're not going to see it until May, June. It's going to roll out to healthcare workers, those who are at highest risk in assisted living nursing homes, as well as teachers. Because I think even if we do have a partial shutdown, we pay some businesses to close and folks to stay home, and we provide means for them to do that financially, we want to prioritize reopening schools and keeping them open. So teachers are definitely on that first line. But realistically speaking, for the average person, we're not going to be able to see this vaccine until May, June, I would say. Maybe sooner, but unlikely at this point.
And doctor, I always wanted to know this as a health professional, as you're seeing this pandemic, what's the most hard thing for you to see as far as how people are responding to this or how they conduct themselves? What's the hardest thing that you see that you're like, ah, I mean, if people would just get this, then maybe we could be better.
I think the hardest thing is to see the cavalier attitude that people have, making false dichotomies as if we have a choice between the economy versus saving lives. We can do both. We can pay businesses to close. We can pay people through relief bills, and really, we just have to remember that we're at war with the virus and not each other. So let's try to be united. Remember, that's how we stand together as a nation. And that's how we're going to get through this crisis and everything else that comes our way.
That is well said. And then, doctor, is there anything else that you'd like to add? Maybe I didn't ask you about that you'd like to touch upon?
The only thing I would say is just like everybody should be wearing their outer mask, right, when they're going out in public, you should also do your part for your inner mask. And when I say inner mask, what I mean is taking care of your health, right? Exercising, eating healthy, taking vitamin D if your vitamin D level is low, all those things to keep us healthy, because that also helps to prevent a serious illness from this viral infection. So both your outer and inner mask are going to be important here to boost your immunity and to protect yourself and others.
That's totally well said, because I even find myself sometimes not just drinking enough water, and I'm like, oh my God, I think I only had like one bottle today.
Exactly. We all have to keep working on that.
All right, Dr. Shad, thank you so much there for breaking it all down for us. We truly appreciate it as we saw these numbers today, and we said, well, let's try to get a little bit better understanding, and we appreciate your input. Thank you so much.
My pleasure. You're most welcome.